That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdulaziz Al Khayyat, and having coffee with us today is Dr. Lama Al Sharif. Welcome to the podcast.
Hi.
As you may notice, this is not the typical setting. For the very first time on the podcast, what we're doing is a virtual interview. It's something we wanted to break into to be able to hear from doctors from all across the Middle East. So we're very happy that we're breaking into this new medium. We won't be doing this for every single episode, but at least we have the option to do it, so we can hear from people as interesting as Dr. Lama. So let's dive into our introduction here. Something that many people do not realize about medicine is that it is as equally objective as it is subjective, specifically as it relates to culture. We know that one of the limitations of modern medicine is that most of the evidence we work with is based on unusually white males or men, which is why there are a lot of pushes to contextualize healthcare to specific cultures and communities. We were actually talking about this, me and some of my colleagues, the other day. So, for example, there's been some textbooks recently that have been developed to help with examining darker skin. So they exclusively talk about examinations on darker skin to pick up on signs like jaundice, et cetera, which we traditionally, in a lot of textbooks, you might see on lighter skin. So today I'm really excited to expand my personal horizons as a physician in the area of women's health. So since I studied in the UK, I've gained the mostly, I'd say, Western perspective on women's health because that's where my practice has been up until now. Of course, I've had some time here in the Obs and Gynae Hospital in Kuwait, so that was also eye-opening for myself. But today I'm going to expand my horizons even more by chatting with Dr. Lama, who we're going to focus on talking about women's health here in the Middle East. She's recently completed her OBGYN training in the Saudi board, so she is now a practicing senior specialist. And before starting our podcast today, we were chatting about how she's had a lot of passion for social media and on educating the public, which is something that we admire on the podcast, and that's why we reached out to her, because we want to help spread her messages and her experience any way we can. So before we dive into the podcast, as you guys always know, we need to talk about our coffee. Dictor, are you drinking coffee with us today, or just me?
It's a straight black coffee.
See, I'm very happy you're drinking coffee because I've realized that not everybody drinks coffee, which I'm shocked about. So at least I'm not.
But most doctors should be coffee drinkers. I'm against any doctor who doesn't drink coffee, by the way.
There.
It's not natural.
That's how you find the best doctors. Make sure that they're drinking coffee. If they're not drinking
Yes,
coffee, don't trust
exactly.
them.
You have to be alert and focused.
And I can't do it without my coffee, to be honest.
Yeah, me too.
Even when it's
Me
midnight.
too.
I'm drinking Arabica today. You guys have
Oh,
Arabica, Saudia?
we do. We do actually, yeah.
Is it as popular as in Kuwait? Like in Kuwait, it'll be every
No,
few months. Really?
no, it's not actually, yeah.
How full is it when you go, would you say?
Um, I don't usually have Arabica to be honest, but I don't hear about it much here.
See, there we're
Yeah.
pointing out some cultural differences. Here in Kuwait, you will not find a spot. It's huge. But yeah, it's a lot of it's my weekend go-to coffee, so I love Arabica. Um, and it's got me caffeinated for this episode. So,
Yeah, that's the most important.
very. Now, a last bit is some shout outs. As you've heard us talk about before, Dream Med Scrubs. Guys, you see me wearing them on the wards. People have asked me about them. Please use the Doctor's Brew discount code. We'll show it here on the screen. We've spoken about this so many times. We post them in our stories. Go out and buy some Dream Med Scrubs. They're based in the UAE. We want to support local here, So go out, get some Dream Med Scrubs like I have. And next is Studio Stretch. The other day I got a stretch from them out in Schweich, and then afterwards I went to the gym. I did my squats, and they were deeper than ever. So guys, really, I can't recommend it enough. And Dictora, if you're ever in Kuwait, go to Studio Stretch. I really recommend
Okay,
it.
sure. You got me excited.
There we go. Okay, now let's talk. Let's dive in. I want to hear from you. your career, your experiences. Tell us a little bit about yourself, please, Dictora.
Okay, my name is Lama Al Sharif. I'm 32 years old. I'm a mother slash doctor. I graduated medical school in 2015.
Mm-hmm.
And then I joined the Saudi Board of Obstetrics and Gynecology in 2015, and I graduated 2021 from the Saudi Board.
Mm-hmm.
Currently, I'm working in a governmental hospital, and on my the side job that I do is I do social media education and awareness, and it's actually my passion.
As we were talking about before getting on to, into the podcast, I think social media, like awareness and spreading education, is extremely important, especially with regards to women's health, because as you know, I think it's fair to say in the Middle East, the amount of patient education about women's health is lacking, and I think it does need to expand a little bit.
I do agree. As After I joined social media, like when I joined social media, there weren't, and still there are not a lot of OBGYN doctors out there,
Mm.
and most doctors, even when they discuss OBGYN topics, they try to move away from sensitive subjects. And for me, I focus on sensitive subjects because I found out that a lot of middle, or let's say most Middle Eastern women, they're it's a culture. It's related to our culture actually, that we're shy and we don't usually feel comfortable talking about our health, period related health, sexual health, pregnancy, and postpartum. And I found out that a lot of women lacking very basic information regarding their body, their femininity, their period health, pregnancy, contraception, postpartum. They lack the basic information. That's why I'm very happy to focus on women's health and talk more about these sensitive topics, as it's really important for all women to have more information about their own body and how to deal with it and how to deal with a lot of problems that most women have.
Do you have an example of like a story or of someone who really stood out in your mind as wow, their lack of understanding about their own body has hindered their health? You know.
So I have a quite few stories. Let me think about really interesting one. So there's a really interesting story.
Mm-hmm.
It's about a couple.
Mm-hmm.
They're a newly married couple,
Right.
and they came to the clinic because they tried for a year to get pregnant
Mm-hmm.
and they could not get pregnant. And after taking focused history from those couple, we ended up figuring out that they don't know how to um, uh, they don't know the basic information about intercourse and what to do exactly to achieve pregnancy.
Really?
So they've been doing it all wrong, and their way of doing it will never lead to a pregnancy. So that was the problem there. It wasn't any fertility issue related to the women or fertility issue related to the man. It was the way.
You're shocking
There
me
was
right
an
now,
issue
to be
in the
honest.
way.
I never
Yeah,
would
I
have
have really
imagined that
interesting
this would
stories.
be. This wouldn't have come up in my OSCE. Let me put it that way. You know?
Never.
Yeah.
See, let me tell you, it's not a common problem,
Mm-hmm.
but a lot of young couples they don't have basic information regarding their sexual health, to be honest.
Okay.
And we need to implicate sexual health everywhere, and we need to speak about it more. Uh, because sexual health will lead to a safe pregnancy, safe delivery. It's all related to each other.
Of course. Now, for what do you advise for, you know, how like what do you think is your best way to approach these sensitive topics with like especially as it relates to sexual health and its kind of taboo nature in the Middle East? What's been your approach that you think has been successful?
My approach is just to be straight
Mm-hmm.
to the topic,
Mm-hmm.
just talk about it clearly.
Mm-hmm.
It's I've seen or I've noticed that it's the best way to just to be very very clear about it.
Mm-hmm.
It's not easy to be clear about it and talk about it in public because we are a very conservative community
Yep.
and we're not used to this. I've been getting a lot of negative or backlash, and
Really?
a lot of people, yeah, a lot of mostly men are not comfortable with me talking about it in public, but a lot of women are really happy that I'm talking about it because they're the one who is struggling.
Well, I'll tell you that this is you have one male supporter here. I think it's very
Well,
important to keep talking about these honestly, um, because I've been in the situation where I've been embarrassed to speak with my patients, you know, and I've struggled. The amount of times where I was like, so is it your time? Is it? And then the patient looking at me like,
what are you saying?
exactly. Like, do I need to go to the bathroom? No. I'm like, no. And then I go out and I'm like, call the assistant. Yeah,
Yeah, see,
yeah, no,
if you spoke more about it, you would feel more comfortable.
absolutely. I definitely agree. Now, how do you said that there's pushback. How do you deal with the pushback?
Yeah. I actually, at the beginning, I used to like reply to these negative messages. Like, I used to like told them, I used to say like, I have to talk about it. A lot of women are struggling and suffering, and we need awareness and education. I just tried to explain myself,
Mm,
and I didn't see any benefit of doing that because some people will just not understand that there's a huge benefit of what I'm doing.
yes.
So I ended up just ignoring these comments and
Mhm.
just not focusing on this negative energy and just focusing on going and giving and just explaining more and telling more. And this is the best for me. This is the best approach, to be honest.
And I really do applaud you. It's difficult to sometimes wait out the negative comments. Even for this
Yeah.
podcast, we've had people send in very few instances of kind of like negativity, um, but you know, you just need to put it aside.
Exactly. And you just need to ignore it.
Yeah. So has women's health or in OBGYN, has that always been your passion, or were you going into medicine thinking, oh, maybe I want to do general surgery, and then somehow it changed into OBGYN?
So I knew that I wanted to be a doctor since I was like a little girl. I remember like I was 7 or 8. Since I was a little girl, I used to tell my mom, I want to be a doctor. أبغى أكون دكتورة. I want to be a doctor. And I do even remember I had this, the toy doctor kit with the
Yeah.
stethoscope and all of this and that. I used to play with it. And then after I went into medical school, when we first starting studying OBGYN, I remember that our professor, he was really interesting. He was really good at explaining the subjects, and he made me fall in love with OBGYN. For me, it was logical, it was fun, it was easy. And then after going to internship and starting dealing with real patients, I just knew that this is the only specialty that I want to specialize in.
Mm,
I felt like I'm comfortable. It is my comfort zone, and I'm comfortable and it is my comfort zone, and I'm just at my happiest dealing with women
mm,
and women issues and pregnancy. It's just magical to be dealing with pregnancy and postpartum. And it's the only specialty where you can tell a patient after while you're discharging her, congratulations. You can never tell a patient after doing an appendectomy or like cholecystectomy, congratulations. You can just only tell a mother congratulations for having a baby.
yeah.
So it's a mostly happy specialty. That's why I knew, and it's the only specialty I wanted to get in. I only had like another specialty in my mind, and I said as a plan B, if I couldn't get into OBGYN, I would go to family medicine and then sub specialize in women's health at the end. That was my plan B.
I relate to you because the only time I want to be a psychiatrist. That's my current trajectory.
Oh, mashallah.
Yeah, but the only time I ever doubted psychiatry was when I assisted in a C-section, and then I held like the baby came out, and I was mind blown that like
Mind blown.
There was one person, now there's two persons.
Exactly.
It's honestly magical. It's eye-opening. It's so magical that I feel like, as a human being, I feel like everyone should witness a birth. You know,
Yeah.
with even, I don't know, like what's the stigma is like, kind of in the Middle East, but my impression has been that men shouldn't be there during the delivery. That's the general feeling I get. And I think that,
Mm,
no, I think you really, especially like for if it's your wife's, baby,
birth. Mm.
it makes you appreciate life, and it just makes you in awe of what life is.
Makes you appreciate women more.
It does. It does.
Yeah, and what a pregnant woman goes through. Even for us as a physicians, when we deliver a baby, we always say happy birthday. We sing happy birthday in the
Really?
OR. We sing happy birthday in the labor room. Yes, like this is what we do. Like me and my
That's
colleagues,
sweet.
they're like
I like
happy
it.
birthday, and we all get emotional. The mother, the father, us doctors, the midwives. It's a happy place to be in. It's most of the time it's a happy place. Even the complications we don't have much.
Mm.
It's mostly happiness, and then just for the small part we get complications, like, but mostly it's a happy field, and it's really fun field. And for you, you should consider OBGYN.
I have certain other stories I cannot share on the podcast as to why I can't go into OBGYN.
Okay, we'll talk about it later then.
Yeah, but I really do applaud you, because also you said something about OBGYN that I thoroughly disagree with you. You said you found it easy. I recently sat the Step 2 exam and I was studying. My weakest subjects were pediatrics, although that one I did okay in. Like, I actually did above average in that one. But then OBGYN, always my weakest. So when you say that it was easy,
Why?
oh, no, no. Oh, no, no.
For me, it was the easiest subject. It's like really logic.
It is. It is. I don't know why. See, I feel that way towards the psychiatry questions. I'm like, you world.
Because you're interested.
Exactly. Exactly.
Exactly. When you're interested in something, you find it easy.
Yeah.
Literally. That's why I find OBGYN is easy. It was the only easy subject for me because I was so interested in it.
Now, for OBGYN, another thing that is interesting about you is that you did it with Saudiya, okay? And the reason why I
Mm,
want to bring this up is because of, again, what I introduced, like context, you know? Uh, I feel like there's some sort of advantage in the sense that you're working with the culture and you understand the
mm,
culture, versus going abroad. This is not to talk down to anyone who specializes abroad. I just mean that there's definitely an advantage there at specializing in the area where you're going to practice. Would you say so?
I do agree. I strongly agree.
Mm.
I had the option to go abroad, but I did not. It's not because I don't want to go abroad. No, I just felt more comfortable staying in my country and close to my family. It's just not related to which place is better than the other
Yeah,
place.
no.
But I do see an advantage, and if you're going to work in the same in this country, like let's say if I'm working here, it's better if I do Saudi board, to be honest,
Hmm.
because you eventually will deal with mostly Saudi patients.
Yes.
And if you're trained with Saudi patients, it's totally different when you're trained with like another, like let's say like Americans
Hmm.
or Canadians or whatever. It's totally different.
Yep.
The culture, the reaction, how to approach them, how to deal with them. A basic thing in being a physician is taking history. صح?
Yeah.
It's like the first thing you do.
Mm.
Taking history, when you're used to taking history with these patients, you're practicing with Saudi patients and mostly Arab patients.
Hmm.
It's different when you're used to take history in English, let's say. صح? You're
Yeah.
taking history in English, and then you end up as a specialist taking history from Saudi patients.
Mm.
It's totally, you will struggle at the end. In the beginning, you will struggle because you're not used to them. You're not used to their language. Different in Saudi Arabia. Like we have, like it's not a different language. What do they call it? Different
Lahja.
It's not an accent.
Um,
لهجة. كيف نقول لهجة?
Lahja.
Um,
Dialect. Dialect. That's the word.
dialect. Okay, it's totally different,
Yeah.
and you will learn.
Yeah.
من الجنوب, from جنوب they're different, and from Shamal they're different. They're just different لهجات.
Especially
And
Saudi.
with
Can I just say, when I drove through
yeah, yeah,
Saudi, I remember at the border,
yeah.
there was times that they looked at me and I was just like, they said something and I just looked at them like, huh?
What?
I was just gonna respond. I was gonna respond in Spanish even, like, ¿qué dices? Like, it was that.
Yeah, but yeah, with time you'll get used to it. That's
Yeah.
why, like, for us, we just learned. We understood. Eventually, we understood everyone's different لهجات,
Like,
let's say.
you know, just like a little, like a basic example of the impact of cultural difference. When I was in Manchester, I studied in Manchester. So my mom is Cuban American. That's why I have the American accent. I went to an American school. So when I would do histories with patients, what I realized was the more American my accent, the more taken aback they're kind of surprised, you know. And so when they were simulated patients, like actors, I realized that if I use my American accent, they kind of like, يعني, how can I put it, يطخون شوي, like they get out of character for the briefest second, you know, because they get like kind of shocked. So I would kind of use that to my advantage to let them kind of ease into the history. So what I would do was I'd often refer to, if, for example, it's a female patient, I'd call ma'am, you know, and that's
Okay.
not used in the UK. Nobody says ma'am, you know, like in a very American way. Once I had a kid in pediatrics, he literally pointed at me, and like I told him, "So you have tummy pain? Where's the pain?" And he just goes, "Are you American, mommy?
Oh God.
It's an American boy." I'm just like, please answer the question. But
Okay,
cultural
this is
differences
not.
make
Tell
an
me this is
impact.
not related.
Yeah,
Yeah.
yeah. So no, I definitely agree. Like cultural differences have a huge impact, and I told you before how the Saudi board is becoming very popular in Kuwait. You know,
Mm.
for similar reasons, people want to stay close to home. You know, they want to stay in the Arab culture when they specialize. How was your experience in the board itself?
Okay, so I had let's say, I think most boards are exhausting and difficult and whatnot.
Yeah.
It's all really, and it's all the same. It's not different. But for me, it was a really good experience. Of course, like as a first year resident, that was really
Yeah.
difficult for me because I've never used to this hectic workload, especially as OBGYN.
Yeah.
OBGYN is one of the most stressful fields you ever get. You're just, during your on call, you're just running.
Yeah.
You don't sit. You cannot something, and most of the times you cannot use the bathroom. You cannot eat. You cannot drink. You're just running around. This one is delivering. This one is having bleeding. This one is doing this and that.
Mm.
So it's really exhausting.
Yeah.
And in my training period in Saudi board, I had the support of most of the doctors I was working with.
Mm.
At the beginning it was hard, but with time it became easier for me. I'm really happy that I chose Saudi board, and I do believe and that it's the board that shaped me to what I am today.
Mm.
I do believe that if I took the board and anyone else, I would not be Dr. Lama, the one you see today.
Really?
I do believe it was hard and difficult, but I believe that I made the right choice. The exams were the way we had a lot of education
Mm-hmm.
in my hospital. We used to do like OSCE simulations. Our hospitals are packed with patients, and I believe that this is the best way to learn.
Absolutely.
Not reading something, not reading a book or articles. The best way to learn is seeing the most
Mm-hmm.
patients during the day or during your call. The most patients you see, the better you get, because you're listening, you're using your hand, you're using your senses, and this will build a great or an amazing or the best
Mm-hmm.
clinical sense you would have. And a good doctor have a good clinical sense. So yeah, I had a good experience, to be honest, in Saudi board, and I do recommend it for everyone. But you have to choose the hospital that suits you.
Right.
It's not about the board. The board is great, but choose the hospital that you feel comfortable in working in, because hospitals are different from each other.
So would you recommend for someone who's considering the Saudi board, maybe it's worth taking a look at the hospitals, visiting, Saudi and
Yes,
you know.
you would. I would recommend taking like an internship or
Mm,
like a 1 month a training, even just as an observer. Just see the how is their teamwork
yeah.
between the doctors. Are they supportive?
Mm,
Support is really important as a resident. Emotional support and giving you a break, so you don't want to end up in like a burned out position. That's the least thing you want to go through, to be burned out.
yeah, and even outside the hospital right now, the at least here in Kuwait, the talk is all about Saudi. The quality of life in Saudi has been increasing. People have been saying that so much has been changing in Saudi, and it's people are so attracted towards going. So I think that's also funneling. You might see a few more Kuwaitis in your board. Uh,
Well, that would be great. You all are welcome in our country, and we would be glad if you guys could join our Saudi program. That would be amazing. I don't think like Kuwait is different than Saudi Arabia. I think we were very similar culture-wise,
oh,
and even living
yeah,
situations.
no, no.
صح.
I like when we went through Saudi. I was telling you for the World Cup. Um, I did. I felt like I was in a part of Kuwait I've never seen before.
Yeah, exactly, exactly. I think we're the same,
Yeah, which is
almost.
it's a which is a nice thing for a lot of people because I'm sure you said that you experienced this when you're debating where do I specialize? Do I go out? Do I stay here? Sometimes you want to stay close to home, and th- that's the nice thing with what's appealing to a lot of people for the Saudi board is staying close to home. So I'm glad to hear that it's been such a positive experience. And for anyone listening, we've had a few questions about the Saudi board and people asking about Saudi board. So here we have a doctor talking about the Saudi board, and she cannot recommend it more. So if that's something on your mind, please take Dr. Lema's advice and go seek an observership. Yeah, it seems like it's a positive experience.
الله يحييكم.
Now, just zooming out a little bit about women's health in the Middle East as a whole, okay? What would you say is the difference between women's health in the Middle East versus, let's say, the West, which most textbooks are based off of and stuff? Do you think there is even a difference?
So, yeah, I do believe there is a difference, but not much of a difference. Like, sometimes we struggle in like in our country or in Middle Eastern
Mm-hmm.
area. Women are uh, they still find OBGYN subjects or women's health or whatnot is a taboo, and sometimes we struggle with women regarding contraception.
Mm-hmm.
Like, let's say if I have a high risk pregnancy, and let's say she have a cardiac or like any high risk issue, and then I talk to her about contraception. Some women and their husbands would say it's haram that we use contraception.
Mm-hmm.
Although it's not haram, and if it was haram, it would not be available in our country. I always tell them that. But some couples do believe that contraception should not be used, and we should get pregnant if God decided for us to get pregnant, we can get pregnant
Mm-hmm.
as much as we want, even though sometimes, most of the times, when we struggle with those couple, pregnancy will cause a huge complication to the mother and to the fetus.
Mm-hmm.
And sometimes the mother might die from a certain complication if she got
Yeah.
pregnant, and we still struggle with contraception regarding if they think it's a religious issue related to religion,
Yeah.
when it's not. Other than that, some patients have a lot of sexual or any sexually related issues, and they would not tell us even as physicians.
Mm-hmm.
We sometimes struggle to let them talk about these problems, and sometimes they don't feel comfortable talking with their husbands around about these
Yeah.
issues. So it's mostly they're shy, it's still taboo,
Mm-hmm.
they're not comfortable talking about it. But other than that, I don't see that much of a difference regarding management of those patients.
What about the difference in terms of doctors? So do you think that maybe in the Middle East, the approach of doctors, male, mostly I'd say male doctors, do you think it differs to kind of how women's health is practiced more in the West?
Yeah. So, Middle Eastern women,
Hmm.
mostly, they're not comfortable with having a male OBGYN.
Yes.
And for me, as a female, I do understand.
Mm.
As a Middle Eastern female, I do
Yeah.
understand that it's our religion. We're not comfortable talking to men about our feminine issues, and a lot of male OBGYN struggle with patients, and I've seen it a lot in my hospital. Like, there's a patient who comes in labor, and then she was like, I don't want any male physician. And we can sometimes we tell her the only OBGYN on call is male.
Mm.
Sometimes they leave the hospital while they're in labor, to the point that I would never allow a male to examine me. And sometimes their husband come before the patient who's on call, who's going to see my wife. Is it male or female?
Hmm.
If they're male, no, only females. So a lot of male physicians struggle, to be honest.
Yeah.
And a lot of, even in my on call, sometimes like there's a male on call and they're like, لو رجال لا. If he's a male, no, no.
Mm.
And a lot of residents, they cannot examine patients and they cannot get trained and learn because most patients will refuse. So I think that male OBGYN should always take permission
Hmm.
from the patient
Hmm.
and the husband, if the husband is around,
Hmm.
and not to do anything behind the husband's back, or if the husband refused for a male doctor to examine his wife, just for your own safety,
Hmm.
do not. We had some like really bad stories, and stories regarding doctors, male doctors, who dealt with pregnant patients, and then bad things happened to them.
So it's a matter of the safety of the physician. Sometimes,
Yes,
yeah,
of course. Yes, it's always the safety of the physician.
yeah. I mean, like I'll share experience I had recently. During my on-call, I had a patient who had a profuse PV bleed, um, and I remember in that moment feeling kind of confused because I took the history, I did an abdominal examination with a chaperone, but I remember I even spoke to fellow trainees or first year doctors. I called them, I was like, guys, how should I go about examination? Because this is the first time that in the Middle East I've been confronted with I might need to do a PV exam or a PR exam. And they said, speak to the seniors. Hold on, speak to the seniors unless you think that they're in imminent, like they were compromised. The blood pressure was fine. The patient was safe enough for me to call my seniors. But so what this situation highlights to me is that I think the education is not only with our patients, but it's also for male physicians like myself. You know, what can we do to protect ourselves and also make sure that the patient is comfortable? You know, um, do you have any advice for young doctors like myself who are in that position?
Yeah, of course. Before you enter the room, knock.
Yeah,
This is Dr.
yeah,
Abdulaziz. May I come?
yeah.
بعدين, may I examine
Hmm.
you? Is it okay? Is it كده كده كده? We usually do
Yeah.
this, but just focus, like take more permissions if you're dealing with Arab or Middle Eastern
Hmm.
women. Most women, some women are just fine and they're open and they're okay about it and everything is fine.
Yeah.
But you might face women that their husbands are too jealous, or they just have their cultural conservations, or what do they call it? Like they're conservative.
Yeah.
They don't allow.
Yeah.
So for your own safety, always focus on your own safety before doing anything. Always take permission. Make sure the husband, if the husband is around, make sure he knows
Mhm.
that you are going to examine his wife, and he if he wants to be around, he can be around.
If I could ask you now a more difficult question about this. So, let's say you're in a position where the patient, it's urgent, right? And you're like, I'm thinking to myself, I'm imagining myself on call. It's 2 a.m. and I'm the only physician next to this patient, and I need to do a PR or a PV examination, and they're critical. The blood pressure's dropping. There's sign of bleeding. Besides having a chaperone, is there any things you can suggest to make sure that we're protected, both legally and safety of patient retaliation? God forbid.
Well, first of all, you would always, like we usually do, take permission in examining a patient.
Mm-hmm.
If the patient agreed, you're safe.
Okay.
If the patient disagreed, she needs to know. She needs to know that by you disagreeing, for me examining you, you might have severe complications regarding your baby, yourself. You might bleed to death. You might go into ICU. Or do you agree to that? And we usually have, like, if the patient refused, a refusal form. If the patient refused for you to examine her, let her sign that refusal form.
Mm-hmm.
So if any complications happens to her, you're safe.
Right.
You tried to do your best, but she refused.
Right.
So you're safe. But at least she knows and she refused.
Yeah.
And you have it documented. As you know, documentation is really important. Always document. Please.
The amount of times I've heard the term medical legal, medical legal, medical legal. I don't know if that's a big term in Saudi, but in Kuwait, you just hear it thrown around the words. Medical legal document, MR8, now.
Of course.
Yeah.
I didn't mention that, but I had a lot of investigations happening while I was a resident. And one of them was, like, I had a patient with PV bleeding, and she was aborting and whatnot. And then I was a resident. So I asked my senior, I was like, I can see the sac, the pregnancy gestational sac, it's at the cervix, and that's what's causing pain. He said, okay, remove that sac. I was like, okay, it will be removed. I went to the patient. I told her, I just need to do an examination. The pregnancy is already aborting. I just need to help you by pulling it out from the cervix because this is causing you pain. She was like, okay, do whatever, doctor, do whatever. And then I removed that sac. So at the end of this scenario, everything was fine. Patient was okay. A couple of months later, I received a complaint. So the husband was the one who filed that complaint. He wrote, Dr. Lama, she inserted a scissors inside my wife's uterus, and she pulled the baby out from her uterus. So he thought that I aborted her. She was not aborting, but I aborted her.
Okay.
Yeah. And then when I went through them, there was, like, doctors from Riyadh, they came, and there was a huge investigation and about this. And then the doctor, she was a consultant, she was like, did you do this to the patient? Did you do that? I was like, yes. She said, did you insert an IV cannula to that patient? I was like, yes, I did. She was like, why it's not documented? I said, I wrote in my documents, I inserted IV cannula. She was like, what's the size? I was like, you did not write the size of the cannula in your notes. I was like, oh God.
Yeah.
She was like, it was horrible. I was post-call, and I was like my psychological, my mental health was like at the lowest point at that time, because you just need to write everything, even the cannula size. Because when the patient complains, you need to protect yourself all the time.
Of course.
All the time.
That, my friends make fun of me in surgery right now because surgical notes. Patient is breathing. Patient is happy.
Yeah.
CST,
just like
continue.
Straight to the point.
Yeah, but
it's not like medicine.
No, it's not like medicine. But I write some notes. I take some time
Better.
on it, and I'm just waiting until a surgeon yells at me for it, but that hasn't happened yet. So.
Even if they yell at you, always do it. Train yourself to do it.
Yeah.
It will protect you in the long run. If something, God forbid, happens, if the patient complains, complication happens, this will protect you.
Yeah.
Literally, it will. This is the only thing.
Absolutely.
We have a saying. Maybe you did heard it before. If it's not documented, it was not done.
Oh, right.
If you did not write that you did it, it wasn't done. Even if you did it, it's just not done, unless you document that you do it.
It's but actually, funny enough, I read a study once that said the number one cause of burnout in medicine is because of bureaucracy and documenting and filing, and because what they saw that was that the majority of a doctor's time is actually spent writing rather than treating.
Yeah,
So it's
I
ironic,
agree.
you know. The one thing that we need to do to
I
protect ourselves is hurting us.
Yeah, I do believe that whatever you do, you will always get burned out as a physician.
Really.
I do believe this is I think this is one of the downsides of the job.
Mm,
You will learn to get used to it with time. You will get burned out at the beginning of your residency. And what I usually say to like new residents now or my colleagues that I'm working with, that always care about your mental health. Get help early. If you're tired, take a break. You need a break. As a medical student, even as an intern or as a resident, you're not supposed to spend the whole weekend studying.
yeah.
You can take time for yourself. You can travel. You can enjoy your time. This is good for you. This is better than spending the whole weekend studying, going back to the house, doing this and that. At the end, you will reach a point where you're just like, I don't want to do this anymore. I'm just so tired to the point I cannot focus with my patients. I cannot learn anything. You will learn a lot in the hospital. You might not learn a lot from reading, because when you read, you try to memorize. You end up
Yeah.
forgetting. When
Absolutely.
you see a case and you go back home, or just after you see the patient, just take a just quick reading about that case,
Hmm.
that's what's going to stick.
Yeah.
So my message is, take a break. You deserve it. You need it. And you like, this will serve you in the future. It will help you and serve you. Don't do like me. For me, I was just so focused on my residency. In the first 2 years, I was so burned out.
Mm.
I learned this late in my residency to take a break and have fun.
I totally agree. You know, when I was studying for the Step 2 exam, the USMLE, one thing that my mom would sometimes ask me, "Oh, how's it going?" Blah 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 blah, and I'd tell her, "Oh, I'm not scoring this score or whatever," and she's like, "Oh, have you considered delaying the exam?" And one thing that I
Mm.
wanted to tell her, what I did tell her, but I don't think she could. Maybe she could relate. I'm not sure. I said, "There's a point that I've gone into with my studying where I am really I'm burnt out or I'm about to be completely burnt out. And so it's either I do this now and accept whatever and leave, it's fine, or I'm not doing this, or I'm doing it really later." And that's why I did my exam very promptly. I was like, right, I'm doing this exam now. I'm not going to delay it because I cannot take this anymore. The day after my exam, people asked me, how do you feel, whatever. I said, I think I'm a different person. And I think that's going to happen to me the day after finishing residency.
I usually say you start living after residency.
Oh, no.
I did. I started living after residency. You know, while I was a resident, I did not know anything else than working, studying, working, studying. I didn't know what I love doing or what I enjoy doing. I was so busy working, studying, just trying to pass those exams. Um, there's a story that I don't usually talk about. It's really inspiring, and I would like to talk about it if there's time.
Please.
It's just gonna take a
Oh,
minute.
please.
So, something that a lot of people don't know about me. So, in my first year of residency, I was my mental health was so like at its lowest point, to the point that I thought of leaving
Mm.
OBGYN. I was so stressful. I had an anxiety. I was so depressed. I was sleep deprived, to the point to what I didn't pass my first year exam.
Mm.
So that's why the board took me 6 years, and it's supposed to be 5 years.
Right.
So and then when I failed the first year, I was like, I'm just not going to. This is too much. This is too much for me. Like, I just can't live like this. I'm so tired. I'm not sleeping. The on call, the stress.
Yeah.
I don't want to do this anymore. And then I was like, to be honest, this is the only specialty that I love.
Yeah.
I need to give it one more chance. So the next year, I'm still R1 because I repeated that year.
Mm-hmm.
I was studying like crazy, like crazy. I was studying during my on calls, post, whatever. I'm just studying. And then when I entered the exam, I got the highest mark uh, bet, uh, between with all the residents around me, even my senior residents. I got the top.
Wow. Wow.
So that was like super inspiring to me. Like, I failed, but that failure of my first year, it made me better in so many ways. It made me know more information. I got the highest mark. So, and I failed the year before. For me, that was the you know what they usually say? You know, you always hear it on Instagram videos. Failures is the thing that will
Yeah, yeah.
teach you. And I learned that. It is true. And then the year after it, I got the highest mark in the whole Western
Oh, really?
region in Saudi Arabia. I got the top. We were 600 OBGYN residents, 600 the number. I was the top.
MashaAllah.
And imagine, and I failed the 2 years before. So I just, from that failure, I started getting the highest mark. Even after my part 2 exam, which is the final exam that you when you pass, you become a specialist. I got a really high mark in my written and in my oral exam.
Wow.
So why I'm telling this story is just I want this story to be an inspiring story for anyone who's having a hard time during residency, for anyone who failed an exam. This is not the end of the world. It's just an exam. Work harder. Maybe you don't know the right way to study. Maybe this way of studying doesn't suit you well. For me, in my first year, I was just reading. And my second year, I was doing an MCQ based studying. I studied through multiple choice
Yeah.
questions. And I figured out this is my way of studying that will make me, this is a better way for me. So I just want this story to be inspiring for everyone that you can reach to the point that you want to reach if you believe in yourself and keep believing in yourself. Even if you fail once, twice, third, just try. You'll become better at the end.
Thank you so much for sharing
So
because
never,
in medicine we
you're
have this
welcome.
thing of every exam is the end of the world. Every exam feels
Yeah,
like if this
yeah,
doesn't work out, I'm done. Bye bye. I'm out.
yeah,
Every time.
exactly.
And you know, it's a bad feeling. Nobody. I've had so many times when I was studying that I was like, especially for the USMLE, I was like, right, this is not for me. Apparently, I'm not good enough. It's fine. It's fine. It's fine. I'm serious. I spoke to people recently, a month or so ago, and I have a podcast called The Doctor's Brew, right? I was talking to people about leaving medicine. That's how intense it got for me. And so whenever I hear stories like yours that that one failure, that one exam doesn't mean anything, it gives me hope and it makes me more comfortable in this career because it's intense, you know?
People think medicine is easy. It's never easy. It's one of the hardest jobs in the world, and it's one of the most complicated. So what you fail an exam in medicine? It's medicine. It's not like you're failing an exam, an easy exam. It's a really difficult exam. Plus, you're working and studying at the same
All the
time.
time.
It's not like you're only in school. You're having on call. You're not sleeping. You're working. You're trying to impress. You're doing research. You're doing presentations. This and multiple exams. So it's okay to fail. Just keep going. If you really love this job, just keep going, and you will reach whatever you want to reach.
And on the line of like being very busy, your your specialty is notorious for your hours are not yours. Your hours are for the whoever's giving birth. The baby's not coming out based on
Exactly.
your on call, right? You're also a mother, which is arguably the hardest job in the world. So I know a lot of our viewers are, young doctors. Some of them are starting families, whatever. Do you have any advice for people considering specialties that maybe are like intense like your own, and how that works with having a family?
Well, I had my baby when I was R5, which was the last year of residency, and I delivered my baby, and
Did you deliver
then
yourself?
I had only
No.
no, of course, I of course
No.
not. I wish it was that easy. Uh, I had my baby, and then 7 months later, I had to go to my part 2 exam, my board exams. So I was breastfeeding, studying, not sleeping, breastfeeding every 2 hours at the beginning. I did not have a maternity leave because residents don't have maternity leave, by
Really?
the way.
Nobody told
Yes,
me
we
that.
do not. We only have annual. So I had 4 weeks at home with my baby. Then I had to go back to OBGYN, heavy, hectic workload.
Wow.
I used to do ER shifts, and I had to leave my baby with my husband. He was only like 1 month old. My husband used to stay all night, every 2 hours, like feeding him, changing diapers. And then I come in early morning. I did not sleep from my 8 hour shift. Take my baby. I have to study for my board. I have to do this research and that. So it was horrible. That year was horrible for
Okay.
me. But just always remember that to start a family, start a family.
Okay.
Because medicine, it's a never ending, like, it's not like other professions. You will always study, you will always read. Sometimes you'll go into more exams. Even if you finish like a certain board, you want to be fellow. You want to take this fellow, you want to do this, you want to take this exam, you want to do that. If you want to start a family, if you feel like you are capable to do two things at once, do it. If you don't feel comfortable, you can delay it. But put something in your mind that don't let medicine stop you from doing other things. Because life is not just about work.
Now,
You need family.
do you think that because I've seen quite a few people give up on the specialties of their dream because they're like, I want to one day have a family. Do you think that's fair?
You should do what you want to do. If you feel like you want to give up medicine to stay home with your children, if you think this will bring you happiness, you will do it. For me, OBGYN brings me happiness, and being a mother brings me happiness. So I have to do both. I have to do
I
both.
really
So and you can never like be 100% in each, but you try your best, and you need family support, husband, mother, mother-in-law, whatever. You just need people around you. You just need love, and you just need to at the end, you're just gonna find a balance to just work through them all.
and I think regardless of career, you need that support.
Yes.
You need people around you to bring you up, regardless. Especially if you're gonna have a
especially in
family.
especially in medicine, especially in medicine. Yeah.
Yeah. One thing I do love about medicine, kind of like you feel a bond to the people you work with. You're all kind of like friends, family together because you have to work so intimately, you know? Like not every career
Yes.
you have to be at 2 a.m. with your coworkers just sitting around.
Yeah, the hospital is your second home, by the way.
Absolutely. Absolutely.
I do believe my hospital is my second home. I have like my own pillow there. I have my bed sheets. I have my everything is there. So I do 50% here, 50% there. Exactly.
Now, the last thing I want to, before we conclude this episode, the last thing I want to ask about is, you know that our audience is a lot of young doctors, medical students. From your perspective, as someone who's trying to educate the world of the Middle East about uh, uh, women's health, I don't know why the word women didn't pop in my head there, but women's health. What do you think for us? What would you like us to take from, from your experience that you want to see changing, so that way we can implement it in our practice, in our future practice, you know?
طيب, so let's say maybe 70 to 80% of any household are women. Sisters, mothers, daughters. Most of our households are
Yeah.
women. And for us, just being women, we do struggle with as simple as our monthly periods. A lot of people don't understand how regular periods, monthly periods, do impact our mental health. Physiologically, it's not something that we just like make it up or anything. It does, hormones does affect our serotonin levels or whatnot, all of these things.
Absolutely.
So what I would like to say that um, we need to talk more about it. We need to focus more about women's health. We need to educate and do awareness about a lot of topics, as simple as periods. We need to talk about little girls who are just starting to get their periods. They need more education. They need more awareness. They need to understand what's going on. Just for us to, because when you think about it, starting a period can impact your mental health.
Yeah.
You can end up with depression. You can end up with an anxiety if you don't work there. Start educating and making all young girls feel that it's okay. We all are going through it. We all went through it. You do this, you do that. It's fine to talk about it. I remember when I had my period, I was so shy to tell my family that I had my period. Like it was like a taboo. Now it's not a taboo for me. I just talk freely about everything. It's normal. It's a normal physiologic experience that all women have.
Yeah.
It's not a taboo to talk about it. It's fine. Back in the days, it was a taboo. It's not, and it wasn't long ago. I'm only 32. Like 20 or 25 years ago, it was a
Yeah.
taboo. So just let us talk about it more, educate our little sisters, our cousins, whatever. Let's just talk about period health, contraception, pregnancy health, postpartum. It's really important for all women to feel comfortable talking about these, expressing their concerns, and to know what to do regarding certain issues.
So the takeaway that I get from this: keep talking about women's health. Don't be scared to say the
Yes,
word period. It's fine. It's normal.
yes, yes.
We're all in this together. Yeah. No. And I really want to take from this. I do hope that on the wards I'm better with my female patients and I'm less shy in saying when was your period. You know.
And I'll tell you something at the end, just when you finish.
No. Go ahead. Go
You
ahead.
can continue.
Yeah. Yeah.
We managed we saw some a couple of patients. They used to say, I don't want a female doctor, by the way, I want a male doctor. There are a lot of patients, yeah, I didn't mention that, like recently in my clinic she was like, no, I don't want a female patient to deliver me, I want a male patient, because they are more compassionate with us. I was like, what? No, we you know how you feel. I'm more compassionate than a male. She was like, no, I want a male patient.
Okay.
So for male, a message: don't feel shy talking about women, talking to women, taking history. It's normal for us. If you look confused or you look shy, we will feel it, and we would know that you're not comfortable talking about it. So talk about it more. With time, you'll be more comfortable.
Well, Dictora, thank you so much for coming on the podcast.
You're
This has
welcome.
been inspiring for me. It's been educational for me, and I'm sure it's the same for our audience. So,
I enjoyed it. I enjoyed it.
thank you so much. Now that's the last sip of coffee for the day. Again, a final special thank you to our guest. And please, if you like what you see, follow, subscribe, and please follow Dictora Lema. If you want to know more about women's health, uh, I can guarantee you she's taught me a lot. So please do follow her because you will learn a lot from her. So till next time. Yeah, thank you.
Thank you very much, Dr. Abdulaziz.
Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.